You done eating?
No.
Look at him. Okay. Okay.
I'm trying to get you guys.
Whiplash.
Yeah, but it's like I don't know how to get us all in here.
Oh, he like.
I'll just keep moving it. Yeah. I don't know.
You're sitting there like, okay.
Hey, Dr. Guirguis. We got the whole gang here today. How you doing today?
I'm great. How are you?
Real
We're
good.
great,
So I have
too.
my mom, my dad, and my brothers are here too.
How do you do?
Hey, Mom. Hey, Marie. Hey, Dad. And then the brothers.
Yep,
Hello.
they're all
No,
here.
Marie and Dad aren't his brothers or her brothers.
Well, I'm glad I can see all of you guys this
Yeah.
morning. Marie, how are you doing?
I think I'm doing pretty good, right?
Are you having any symptoms, Marie? Pelvic pain,
No,
leg swelling, anything like that?
nothing.
Okay. You're able to urinate okay?
Yes,
Excellent. And no bleeding, vaginal bleeding, no rectal bleeding, nothing, right?
nothing.
Okay. Well, the CT scan that you just had does show that, at least in the pelvis, it seems that the disease is slowly coming back. Yes, there's a small little nodule in the lung, but it's tiny. It's 2 millimeters, which is basically nothing for now. But in the pelvis, it seems like some of those lymph nodes are starting to get bigger. So, obviously we treat, cancer 3 different ways.
Okay.
Surgery, chemotherapy, and radiation.
Okay.
So in ovarian cancer, we tend to shy away from the radiation in general, at least up front. And so we usually tend to kind of focus on surgery and chemo.
Okay.
I would say surgery is not an option, not a good option, because, again, to do surgery without chemo doesn't necessarily make sense. And it is starting to go into what they call the inguinal nodes. And so I would say surgery is out.
Okay.
So then you're left with the other 2 options, chemo and radiation.
Okay.
Chemotherapy, it's been a while since you had it, Marie, so I'm not sure how much of it you kind of remember, but, the chemo would be kind of similar to what you had before.
Okay.
It could be a 2 or 3 drug regimen. It can, we could try to save your hair. You could change it a little bit. But the goal of the chemo would be to try to get you into some kind of remission again.
Okay.
You've had remission for several years with the chemo, and but it was also not easy for you to go through it. You also struggled with it a little bit. So, the typical side effects of chemo would be radiation. Fatigue, nausea. I would just say those are the biggest ones. Alternatively, okay, you can focus, and this is all I'm still talking about treatment. Your other option would be if we decide not to do chemo, and remember, chemo is what we would call systemic, which means you get it in the blood and it goes over the entire body.
Okay.
So it would treat this potential small lung nodule, which is 2 millimeters, which is not necessarily cancer, I don't know, but it would treat that. It would treat the whole body. But again, it would be meant in a way to try to get you back into remission.
Okay.
And it would be the same. You get chemotherapy once or twice every 3 weeks, and that would be 1 cycle. You would need probably 6 cycles, because I'm thinking like it would be a carbogenzar of acid or something. Yeah. So we could try to play with it, but a cycle is still 3 weeks, and you would get it over a period essentially of, it's 18 weeks, so 6 cycles of chemotherapy. So that's the chemotherapy route. Also, under the umbrella of treatment, we could say, well, most of your disease, I would say 99% of it, is in your pelvis.
Right.
Therefore, why don't we, ignore what's in the lung right now because it's so small, and just get some radiation to the pelvis.
Okay.
Pelvic radiation, not painful. You're not radioactive, so nobody around you has to worry about that. They could do it probably over a period of probably around 3 weeks.
Okay.
Where maybe sometimes even 2 weeks, but let's just say 3 weeks, where they radiate you over every day. Probably takes about 15 minutes per day. So Monday through Friday. So you'd go in every day for radiation, and then you would, be done within 3 weeks.
Okay.
The advantage of that would be called palliative radiation. And that's very important that you understand that. Palliative radiation means you're not getting the full dose of the radiation. You're getting about 2/3 of it,
Okay.
which is enough to control the disease in the pelvis, not sterilize it or eliminate it.
Okay.
So that would be kind of a very good Band-Aid to control your pelvic disease. Well, why control it? As I always talk about, in the pelvis, kind of that's where all your plumbing is, and all the major blood vessels go into your legs. So if you don't treat it, you are at higher risk for clots in the legs. Eventually, your legs will swell up and call lymphedema, where your legs get heavier. It can cause issues with your bladder and your rectum.
Okay.
So the palliative radiation can buy you anywhere between 6 months and a couple of years of control of the disease in the pelvis. Okay?
Okay.
It has nothing to do with any disease outside of the pelvis. You guys following me?
Yes.
Okay. So, Debbie, are you with me?
Yeah, Diane. Yeah.
Diane, I'm Diane.
That's okay.
So, I guess it's very important to understand the palliative radiation is really meant for quality of life, so that no one is suffering. Now, that's all under the treatment options. So just to recap, under treatment, surgery, I don't think is a good option, and then it would be left to chemo, which is more of a long-term, enduring type, plan, versus palliative radiation, which is quality of life. Give it daily for probably around 15 treatments is my guess, so 3 weeks, Monday through Friday. Side effects of that probably is fatigue. That's probably the biggest side effect. And then, of course, you can get issues with, your bowels or your bladder long term, but I don't think that's an issue. So I'm going to ignore that part of it.
Okay.
The other option is no treatment. And so, if you go down the road of no treatment, then you're going to be focused more on quality of life, which would be more like a palliative care and or hospice type, if you need it. So that means that, Marie, you're not having any symptoms.
Right.
And your quality of life right now is very good. You can do nothing and really just continue going through life, enjoying, family and doing all the things you're doing. And then at some point, if the pain or disease gets bad enough, then treat it at that point. Again, who knows at that point where the disease will be and how bad it'll be, and are you gonna be able to get transported and back and forth, and so that would be option 2 is no treatment, and then just kind of go for now, and nothing changes, and we ignore the CT findings.
Okay.
Or you could do a combination. So you could take the palliative radiation, get control of the disease, and then go down the road of, palliative care or hospice if that's something that is needed in the future. So in other words, get the radiation, do nothing more, and then down the road, again, if we need to do anything more, we could try to do something more at that point. But I think kind of that's my thoughts. So my thoughts are, if you want my opinion, I can give you my opinion.
Yeah.
Yeah, so we were looking for you to be as direct and transparent as possible, because this, from your
Yeah.
experience and everything, so.
I would honestly say the palliative radiation is the best bet because I don't want to see mom suffering.
Right.
Because in 3 months, 6 months, she will have issues. And then I would do nothing more. I wouldn't do chemo. I think that's going to be hard for mom to tolerate. We could even do, I could even consider doing a pill like Lynparza.
She had tried that.
Did you try Lynparza or did she never wanted it?
We tried it for like 3 months or something like that, but she was like, it was not her. Like she was very drawn out, very weak, tired, so.
Okay, so then I would honestly try to, shy away from, the systemic chemotherapy unless, again, that's something you guys want. And obviously, I will always work with you.
Mm-hmm.
But I would just stick to the palliative radiation. And then probably, if you want my honest opinion, don't check any more CAT scans.
Okay.
So unless you want me to be more active, where you're really trying to fight the disease, I'm happy to do that. But if that's what you guys want, that's what I'll do. But I think the radiation can, potentially extend mom's, life a little bit. But really, most importantly, not allow mom to suffer.
Right, and that's what we're looking for that too, so.
Yeah.
Okay.
Yeah.
So, you ready for our questions?
Sure.
Okay. So, now, because I'm totally hearing your advice, okay? But if we went the chemo route, just how mom would come in, that every couple of, weeks, every 3 weeks to have it done, are we looking at any chance of remission?
Yeah, a pretty good chance of remission, actually. Again, she hasn't had chemo in 2 years. How long? When's the last time mom had chemo? It's been a while.
It would be January, 2 years ago, yeah.
Yeah.
Right? January?
So,
Something like that.
so yeah. I mean, I think with chemo, the odds we get mom into remission probably hovering around 60%.
Okay.
Again, assuming she can tolerate the 3-drug regimen, tolerate. Even if I drop one of the days, even one, because this regimen is given twice every 3 weeks. So even if I just give it once every 3 weeks,
Right.
there's a pretty good chance we can get mom into remission. The odds are in her favor that we can do that if she can tolerate decent doses and do the 6 cycles. Absolutely.
Right. Okay. I'm we're trying to figure out where to start with my notes because that was one of the questions. So with the treatment, is it we couldn't remember exactly before. Is it half the chemo because it's not full blown chemo? If she would have had surgery and how we go more extensive, her losing her hair chemo. When we were in the office, that was a lower dose of the chemo, right? The last time, or was that
So let me say this, Diane. She still has a ton of chemo options.
Okay.
There's, the drugs that are coming out are every few months another drug is coming out.
Right.
So it's not from a lack of chemotherapy or lack of options. It comes down to what mom can tolerate, both her bone marrow, but most importantly, physically, mentally, what can she tolerate?
Right.
So I could, lower the doses. I could play with them. I could extend it. I could do a lot of things.
Right.
All of which of hoping if that's the route you guys want to go down, of, getting her through as much as I possibly can.
Right.
If we do that and she can't tolerate it,
Right.
well, then we can always stop it. So
Okay.
it's not like it's but again, she hasn't had chemo in several years.
Right.
She should have a pretty decent response.
Okay. So I'm just, because I know we're not going to obviously make a decision type, but just so I have, with everyone's questions, just making sure. So
Yeah.
with remission, let's say mom does great with the medicine and, we go through remission. You're saying it's a 60% chance that
Yeah.
it can be remission, but what are we looking at after that? How soon, I know it's playing God, but how soon do we think the cancer could come back after that? Because with us not
how
taking
long
us
is the remission?
right.
So I would say, good odds if she could tolerate the 3-drug regimen, maybe 60% remission.
Mhm.
And then once she finishes, and let's assume she's in that kind of 60% range, then we would keep her on the drug called Avastin.
Okay.
And then, so that would be called maintenance chemo. So once we get them into remission, how do you maintain the remission? And with that, the remission can probably last between 12 and maybe 18 months.
Okay.
And in fact, truth be told, Mom has done much better than we had all anticipated, not being on chemo for 2 years or two and a quarter years.
Right.
So I would just say, the odds are in her favor that her cancer is sensitive to chemo.
Right.
So she had a durable remission the first time. And so the second time, I would say, again, standard, I say most people, because the standard would be to maintain Avastin after that.
Mm-hmm.
Yeah, Mom doesn't have to do any of this. I'm just saying.
Right.
If you
No, you just want, yeah, because we just want to hear it all.
I'd say between a year to a year and a half is a fair estimate
Right.
of how long this remission would last. And maybe longer, who knows?
Right. But no matter what, the cancer will keep coming back.
So the answer is it's not curable.
Right. Okay. That's
So it's treatable. It's just not curable.
okay. That's why I just want to make sure that was cleared.
Yes.
So let's say we go a totally different route. If we go with the radiation, like you were saying with the hospice, what does that look like? So looking at that, because just to backtrack a little bit. So the marks on the pelvis, is it more so are we looking at the blood, or the tissue, or the bone around the pelvis area, or where exactly or is the lymph nodes in that area? I don't know if there's lymph nodes in that area, but
Yeah, I mean, she's got lymph nodes in that area, and a lot of them.
all right,
And we all have them there.
okay,
But it's in her pelvic sidewall.
sidewall,
So
okay,
sidewall, that basically means it's nearing the ureter where the kidneys are kind of emptying the urine into the bladder.
okay,
It's hitting, it'll start potentially at some point affecting the major blood vessels to her legs.
okay,
Again, left unchecked, it can cause problems with her bladder or her rectum.
right,
Again, not anywhere near that. 'Cause she's doing great.
right,
I'm just trying to think of how to, again, if you're not going to do the chemo, how to prevent it from causing her issues.
no, I totally, yeah, we're here, that's perfect, yeah, sorry.
Yeah.
Okay, so this is just slowing down the cancer if we go the chemo route with the hospice. So is that something that we're looking at? She would just be in home with that? Or is that an outpatient thing?
So I would say with hospice, I would do nothing with that right now because
Okay.
Mom's quality of life is pretty good.
Right.
And hospice is basically a program where you sign a contract with some company.
Okay.
And that company essentially will deliver to your home a bed, a hospital bed, or a commode, or this or that.
Mm-hmm.
Maybe the nurse will come out once a week for a couple hours to make sure Mom's okay. Again, I don't see that right now.
Okay.
And so to say, that's the mentality, but I wouldn't be signing up with hospice right now. I would just say, hey, you know what? We're not going to be actively managing this cancer, and Mom is not suffering, and her quality of life is good.
Okay.
Therefore, if she starts having pain, starts suffering in that way, then you'd kind of hook up with hospice, and they're much better than any of us are at pain control. I mean, I could give you Mom some narcotics, but they're much better at controlling all of that.
Okay. And then just so, let's say we go months down and Mom's getting worse. What does hospice look like when it comes to her regular medication? Are they going to make her get off all medication, or is it status quo? Everything else stays the same. We're just getting extra help.
Hospice is meant for really end of life. So she would be taking any medication she's on, but you would not be doing heroics.
Right.
If Mom starts having, for example, shortness of breath, you're not going to take her to the hospital and start looking for clots. You're not going to, if Mom's, got, whatever, you're not going to be actively trying to manage those issues.
Right.
So the focus changes. Now, basic meds, no, for sure, she'll stay on that.
Okay.
But they won't say, oh my God, now you have a new lung lesion, let's radiate it.
Right.
So the heroics and the active management goes away with that, but not the basic day-to-day meds and living.
Right. Okay. No, it gives us a little clarity here too. So with the radiation, we didn't go. The radiation sounds like to help her pelvis and her bowels and everything, her bladder and everything. So because we're wondering, like, with her walking, because her walking is getting really slow. And now it makes, because it's going between, is it the dementia or where the cancer is? And it sounds like more so it's where the cancer is.
Oh, no.
Oh, you don't think so?
Her walking is her walking.
Oh, okay.
This is not bad enough to cause that problem.
Okay.
Not yet.
Okay. But it could, down the road, affect her use of the bathroom and things like that.
More importantly than that, it can make her legs get bigger.
Okay.
Imagine if you have a tumor pushing on a vein. Okay. All the blood's going to the legs through an artery.
Yeah.
But blood can't make it back up to the heart because it's partially blocked. Mm-hmm. So the legs are getting heavy. So imagine adding another 5 pounds or 4 pounds or whatever weight to her legs.
Right.
Then her legs get bigger so that she moves less. And that's kind of the risk. I'm not saying this will happen. I'm saying it may happen.
Right.
You understand? So That's what I'm saying. It's the legs get heavier. She walks less. She stays in the bed more. She'll get more bed sores. And that's kind of potential. Again, I'm not God, but I'm just saying if it continues down this road, that is the risk.
Right. Okay. You guys have any other questions or... Doug? I'm just making sure everyone has a question.
Maybe just really quick, go over like radiation. We're looking, and again, we can't predict anything, but radiation, we do that for 3 weeks, and then maybe she has a good quality of life for 6 months, and then we look at a hospice. Where chemo, if she's in that 60% chance frame, after chemo, we're looking at maybe 6 months to 18 months of quality of life, and then maybe hospice. Is that what we're kind of talking? Is that clear?
No, that's not what I said.
All right, good. Sorry, thanks.
The second part after the chemo, I mean, again, we have so many drugs out there that if mom can tolerate it, mom could potentially live for many, many years with the chemo. It is mom's tumor biology seems to be good and responsive to the chemo. So the chemo itself, she may actually do very well for years with the chemo.
Okay, thank you.
But that's assuming she can tolerate that. So if we're going to go down the road of chemo, she can tolerate it. We can be fairly aggressive. She's in that 60% range. She could live for many years with, again, assuming her organs are functional and everything. She could, there's so many drugs out there now that people are living a lot longer with it.
Okay. Thank you for clarifying.
Yeah.
Of course.
Did you have questions, Dan?
No, I can't.
Yeah. That's right. Okay. So what do you say, because obviously we're going to, we have to sit and talk about everything you've shared with us today.
Yeah.
Like, what do you suggest, how long can we make before we actually have to make a decision? Are we looking a couple of days, a couple of weeks? We have to do this, now?
No, because remember I said, Diane, one of the options is you do nothing until mom has symptoms.
Right.
So that timeline comes down really to all of you guys.
Right.
You feel like you want to be more proactive and get the radiation done while mom is still able to move and this and that, great. If you feel like that's more than you guys want to put her through and that she's not suffering, so why put her through it now? And let's just keep the radiation in our back pocket for a later date. We could do that.
Okay.
Again, that radiation is really meant to control small volume disease before it becomes an issue.
Okay.
But it's not a foregone conclusion that it will be an issue. It's just more likely than not it will be.
Right. And that's done at the hospital or in the office?
No,
The
not in the
hospital.
office. Where do you guys live? Or where about?
Oh, well, we always go to Palos Hospital, because
Yeah.
Silver Cross is close, but we always go to Palos for everything, so.
Oh, I wouldn't do it. I would probably do. Do you know where Mokina is?
Yeah, we live right there, like we're Tinley Park,
Oh.
Mokina area.
So then it would be Mokina. There's a radiation center right there.
Oh, okay,
Yeah. Or Orland Park. So
okay,
I think it's Mokina actually. We would send mom to Mokina.
okay,
Again, it'd be, up to the radiation oncologist to really determine how much radiation and how long.
okay,
But fair guesstimate is for palliative radiation, it's about 3 weeks, 15 treatments.
okay.
Thereabouts, you may get delayed a few days here or there, but it would be actually super convenient if you decide to do that in that area.
Okay, no, makes it convenient. Okay, perfect.
Yeah. Yeah, so again, you have a lot to think about.
Yeah,
We all want what is best for mom. And I went over the spectrum,
right.
not opposed to being more aggressive and giving the chemo. I have spoken to Belandrin. I think that's her doctor.
Yes.
Jorge. I've spoken to him, George, multiple times about mom, actually, up until even maybe a month ago.
Okay.
And I think we're all amazed how blessed mom has done. And,
Yeah.
so we're all here to support mom, whatever you guys decide, whichever route you want to go.
No, that sounds good. I appreciate answering all our questions.
Of course.
Yeah.
Hopefully helpful. Again, she's in a good place. So
Yeah.
she's not suffering.
No.
She's got a good option.
Right.
And just that's what route you want us to take.
Okay. Well, that sounds good.
All right.
Okay, well, I'll keep in touch, once we have our conversations and everything. So I really appreciate taking the time, though.
Oh, of course, Diane. You have a great day. All the best to the family. Bye, Maria.
Bye-bye.
Thank you.
Bye-bye.
Bye.
Bye.